They're all open, which is great. God bless America. I want them open. But then you shut down a little coffee shop. And you shut down and you threaten churches. I mean, that's what's disgusting about this whole thing is the hypocrisy. If you're a millionaire and a billionaire, or you're a member of the government, because last time I checked, Polis still has a paycheck.
Right.
You're worth hundreds of millions of dollars, and you're still taking a government salary, and you have a paycheck along with the legislature, but you're going to shut this coffee shop down. Shame on you. You're a hypocritical liar, Polis. That's what you are.
Oh, talk about lying. I watched one of the, I barely stomached it. I don't know how I made it through, but I stomached one of these press conferences that he threw this last week. And I got to tell you, at first I thought, okay, this makes sense. So they had this nurse at the press conference, Polis did. He brought her out, introduced her. And this is all after his hee-hawing about how, we all need to come together, blah, blah, blah. So this nurse by the name of Laura Rosenthal comes out, quote, "It's not an old people disease or a sick person disease," end quote, she said. She said this in front of everybody, on the authority of the governor, here as a medical professional, as a nurse. Well, let's just check into that. Let's see. Is she lying, or is she telling the truth, or maybe partial truth? Let's see. Well, guess what? We found an article just came out about yesterday, it looks like. Over 57% of the Colorado COVID deaths are linked to long-term care facilities. So over 57% are in nursing homes, retirement homes, these long-term care facilities. And it's truly tragic. It's horrible. Yeah. But locking down all of society, trying to get every single person, regardless of age or health, to stay at home, it didn't save those 57% of the people who died from it. I mean, it didn't make a difference for them. It's not making a difference at all. So not only is Polis and the rest of the government wrong in terms of trying to abuse our rights and inflict this socialism upon us, but they're wrong in their solution anyways. Their central planning fails. Central planning always fails. Let's look at the numbers I pulled today from the Colorado Department of Health. So all the deaths are attributing to COVID. 99% of those deaths are 40 plus. So 99%. So sure, 40 is not that old, right? So is it a old person only disease? Maybe not. Okay, let's look at the next age group. Let's go up another decade. 50 plus, 96% of the deaths are people 50 plus. Well, now you're getting up there a little bit, right? Mm-hmm. Let's go up again. 91% of the deaths at the Colorado Department of Health is attributing to COVID are 60 plus. 91% of the deaths are around retirement age. 78% of the deaths are 70 plus, and 55% of the deaths are 80 plus. So while it's not entirely true that it's not an old person disease, it is mostly true that when you see that more than half the deaths are coming from these long-term care facilities, and then 91% of the deaths are 60 plus. I mean, that's the older segment of our population. So, they're trying to scare you, basically. Polis and his nurses and his little people he brings in front of his press conferences, they're just trying to scare you. They're trying to scare you into obedience, scare you into compliance, and get you to obey. That's basically their goal.
Well, and I'll go a step further, Brandon. I mean, that ties into the fact that it's one thing to look, we have the stats, and those are good. Those are true stats that you marked. They're from the state's websites. But then there's these other articles that you see coming out from the local area, like Montezuma County. And I don't know if you saw that, but Montezuma County, the coroner's office is disputing the state's claim that of a couple fatal cases where he's saying this one guy had alcohol poisoning, and that's how he died, was alcohol poisoning. Here's the coroner who tests the body, does the autopsies, right? He's part of this whole process, and he says it was alcohol poisoning that killed the guy, but yet they labeled it as COVID. So what's going on here with the real numbers too? I mean, we're getting numbers from 10 different directions, and you can't formulate. We can't keep doing this.
Right.
That's the problem. So I mean, what numbers are real too? But yeah, it's clear these numbers in the nursing facilities, that's tragic. And once again, shame on the bureaucrats and the health departments and Polis and all the rest of the elected crews out there that allowed that part to happen, because this so-called central planning, they sure weren't prepared for what's going to happen to grandma.
Right.
In the nursing facility.
Oh yeah, and not to mention that the convention center and the Loveland Ranch Events Complex. So get this. Remember this. This has been 2 months. This whole thing's been going on now. And I remember, the governor came out and said, "Hey, we're going to build these great medical facilities for all these beds and housing all the millions of people that are going to be infected with this COVID thing. And guess what? Just an article recently. So the Colorado Convention Center is not only, it's not even done yet. It's not even done being prepared for these beds. It's June 4th. So here we are. Today's May 14th. This is going to be almost another month, basically, until the convention center is even ready to start receiving patients. Well, look at the numbers. A month from now, the hospitals aren't even, I mean, they're not in trouble now. A month from now, they're not going to be in trouble either. So we have till June 4th till the convention center is done. June 11th, the Loveland Ranch Events Complex will be ready to receive patients. So these massive undertakings, I mean, completely and utterly ridiculous. And guess what? They cost taxpayers nearly $50 million. $50 million of taxpayer money to rent the convention center and turn it into a field hospital, as well as the Loveland Ranch Events Complex. I mean, it's a total and complete failure.
And for what? I mean, I'm looking at more numbers from the COVID-19, since Colorado Polls doesn't like to look in depth at anything, and they want to slam the data that the Republicans are putting out. So let me spit some real data to these guys, since they don't go to their own websites they create. COVID19.colorado.gov/hospital-data has the actual numbers of current hospitalizations due to COVID, the impacts of COVID right now. And as of today, May 14th at 2:45 p.m., there is the number of patients currently hospitalized for confirmed cases of COVID-19 is 514. 514, right? And if you go down to the list, I mean, last week we were talking about this, and I mentioned it was like 600 or something like that. And the week before that, it was 700. Here's the deal. It has dropped pretty much every single day. And Democrats, Jared Polis, everybody else were like, we're going to have this huge outbreak due to these crazy radical people out there protesting. And Weld County is opening their doors for business. So we're going to have this huge outbreak because of this opening. Well, ever since all these protests have been happening, and since we got in Weld County's opened, and you see more people go out, and I love Home Depot, God bless them, because I'm there almost all the time right now. But when I go into Home Depot, there's no social distancing going on there. And since those have been open, the number of hospitalized, confirmed COVID cases in hospitals per day has dropped to 514.
Wow.
514, yet we still have hundreds of thousands of people filing unemployment claims.
Right. Out of millions and millions of people here in Colorado. How many millions in the Denver metro area? And we got 500 people in the hospital. Now, you know,
over
my heart
5 million people in Colorado, over 5 million people in Colorado, and 514 people in the hospital with COVID right now.
Right. And if we follow the stats we saw earlier, you know, maybe upwards of 57% of those people were from long-term care facilities.
Right.
You know, so you think, how is this a threat to the general public? How is this a threat to the average Joe out at Home Depot or out at CNC brunch, and you know, with your mom for Mother's Day? I mean, it's completely ridiculous.
Maybe I'm wrong, and I'm just a dumb political hack that, you know, has a business degree, but maybe I'm wrong. But when I look at the numbers here, it seems like this could be more targeted. You got a problem in the nursing facilities. You got a problem in the elderly population. Why aren't we focusing there?
Right.
In still keeping our economy alive. I'm not saying that I don't know the Sweden model or whatever else, but this is common sense. Like, you got a problem in one area, and why wouldn't we take the project and focus there?
Exactly. And that's why capitalism, that's why free markets, they actually address problems where the problems exist, not try and create a blanket solution to create solutions to problems that don't even exist.
Right.
I mean, that's the difference between that's why central planning fails, and that's why the free market succeeds, because resources can be diverted to where they're needed, not wasted or handed out to political cronies. I mean, it's you know what? It's true. More people are going to die from the government stay-at-home orders compared to dying from the COVID disease itself. And if that doesn't wake people up to realize the nature of this government we live under, then I don't know what will.
All true facts, man. I mean, you can't put people out of work and put them in their backs in a corner.
Yeah.
It's just not healthy. And since we're talking about health, I mean, That's one thing that we fail. Like everybody's always talking about, what about mental health? What about mental health? What about mental health? What about it? Obviously, Polis and the Democrat Party that controls everything in Colorado right now, and the unelected bureaucrats feel like they're focused more on the fear of this disease. And I'm not saying we shouldn't look at the disease, even we should be paying attention to it, but to go ahead and shut down all the other, unintended consequences of how we're handling things is just stupid. It's incredibly stupid.
Just stay at home for 2 weeks to flatten the curve.
Right.
Flatten the curve. Okay, it's been a couple months. Well, now just stay at home till there's a vaccine. Just stay at home till there's a vaccine. And you know what? Hey, that's great. We'll have a COVID vaccine because, the flu vaccine, that's what eliminated the flu from society.
Right. There's no flu anymore.
The flu and flu's gone, right?
Yeah. Pneumonia doesn't exist either.
So as soon as we get this COVID vaccine, nobody will ever get COVID again. You can go out and as long as you follow the government's rules, do what you want, right? Ridiculous.
It's insane.
Ridiculous.